Valen, thank you very much for that update on the day's sport. Let's move on to some other news now, because Gauteng has recorded 4 cases of measles in recent weeks. The National Institute for Communicable Diseases says it's working with the World Health Organization and Unicef to investigate and respond to the outbreak. For more on this, we're joined by the Health Department's Lesley Bamford. A very good evening to you, Doctor, and thank you so much for your time tonight. Put in context just how unusual this is.
Good evening, and good evening to the viewers. So we constantly are monitoring to see and investigating any measles cases across the country, and we do see sporadic cases across the country on an ongoing basis. However, what is currently of concern is the fact that we now have 4 cases in one province and 3 of those cases in one district, and in such a short time period. Mm-hmm. So we know that because of less than optimal vaccination rates, which to some extent have been worsened during the COVID, coverage rates have dropped during the COVID pandemic, we are always at risk of experiencing measles outbreaks. And currently, we have accumulated a fairly large number of children who are not vaccinated, and therefore we have to be very vigilant. And when we see a cluster of cases like this, it does meet the criteria defined by the World Health Organization for an outbreak, and we need to respond very proactively.
So 4 cases, 3 in the Tshwane area, another on the West Rand. This has now made the rounds through the media. We're speaking to you tonight, for example. Do you think that the reaction, the public and media reaction, is proportionate to the size of the problem?
So the problem is not a huge problem at the moment, but as I indicated, we know that measles is extremely infectious, and it can very quickly become a far larger number of cases, a far larger outbreak.
How do we prevent that from happening?
So I think why we like to be proactive and to engage with the media is so that both healthcare workers can be alerted to make sure that we do identify any additional cases. And of course, to really remind and encourage parents and caregivers to check whether their children are up to date with their vaccinations, and if not, to come to one of our health facilities and to make sure that their children are vaccinated so that their schedules are up to date.
So when you look at some of the symptoms that have been listed based on the warnings you've issued, a runny nose, a cough, fever, at a time when in South Africa we're in flu season, you also have COVID-19 cases, how concerned are you about possible misdiagnosis?
No, well, absolutely, and particularly in the early phases, measles can be difficult to diagnose because the symptoms are quite non-specific. A fever, a runny nose, a cough, some conjunctivitis, redness of the eyes. And most commonly, the diagnosis is not made during that phase, and it's only when the child develops the characteristic rash that a diagnosis is made. Now, the problem is that children are already infectious during that early phase, and that's why we really want our healthcare workers to be very vigilant and to be thinking of the possibility of measles when they do see children who may present with, as you say, these rather non-specific symptoms.
Just on the issue of the vaccine then, can the health department give a guarantee that it's a vaccine that's available at each and every hospital, each and every clinic in every corner of South Africa at the moment?
So we do have sufficient supplies of vaccines, and we work very hard to ensure that our facilities do always have the vaccine in stock. And if people find clinics or other health facilities that don't have vaccines, they must please let us know so that we can make sure that supplies are sent to those facilities. But really, we would all expect all of our health facilities, particularly in the public sector, but also in the private sector, to have the vaccine in stock. It's a very safe and effective vaccine, and we would really urge parents and caregivers to make sure that their children are fully vaccinated.
Dr. Lesley Bamford from the Health Department. Good to have your time. Thank you.